Ladies and gentlemen, mental health conditions contribute to an enormous burden of disease, disability, and mortality. And I wish to share with you some statistics which demonstrate the mental health status in Kenya and globally, and the urgent need, therefore, to invest in this space. To begin with, the projected prevalence rate of mental health condition stands at 10 to 15% of the global population, and a vast majority suffer from depression. In other words, we are estimating that 350 million people are affected globally. And in Kenya, mental illnesses are a significant cause of ill health, with an estimated 25% of outpatients and up to 40% of inpatients health facility visits have diagnosable mental health conditions. And when we speak of 25% of outpatient visits, in Kenya every year we have 64 million visits to an outpatient center. So you can calculate 25% of that. That's a huge burden. The country has also witnessed an unprecedented rate of suicide, with an estimated age-standardized suicide mortality rate of 5.6 per 100,000. And I'm sure you all saw the story last week that was featuring about 468 cases of suicide in the last 3 months, compared to about 300 in 2019. And so these numbers are staggering, and therefore we need to do something about it. In terms of economics, when we measure the burden of this disease, we've come to learn that the global burden of disease, measured in terms of disability-adjusted life years, and 33% of years lived with disability are attributable to mental, neurological, and substance use disorders. And therefore, Your Excellency, ladies and gentlemen, despite the high disease burden due to mental health conditions, majority of people do not access services due to various reasons, including that these services are not available in their communities, that the services are not affordable, that we lack adequate resources and systems in terms of providing comprehensive quality care services, including also investing in human resources, medical products, and commodities. And so to address these challenges, we have to recognize the role of concerted efforts, and that is why we're here today, Your Excellency, partnering with the private sector, Chiromo Hospital Group, the regulator, the Ministry of Health, represented here by our Director of Mental Health Services, and NHIF. All these are partners coming together to ensure that we are able to provide this service. And in recognition of this, Your Excellency, allow me to appreciate your efforts, particularly in the Beyond Zero campaign that you've really mounted and been a champion of. And perhaps this is a discussion that then Connie and I need to have when it comes to integrating mental health services in that service. We do know mothers, particularly post-delivery, do suffer from different kinds of mental health conditions and issues when it comes to depression and psychosis. And now that the Ministry of Health has put in place psychologists in all the 47 counties, then this is an initiative where we can actually integrate this service into the mobile clinics. And so this is something that we need to discuss, along with adolescent health and geriatric care. And so currently in Kenya, we are experiencing an increase in demand for mental health services. And the prevailing situation that has led to this demand is what we're doing here today, celebrating groups such as Chiromo, who've put in place resources, talent, expertise in raising public awareness, in reducing stigma when it comes to mental health diseases, and in ensuring that we're able to change the trends of mental health conditions. As a Ministry of Health, we do remain committed in implementing various policies and strategies to transform mental health services in Kenya. And to begin with, we do have the implementation of the task force report put together by His Excellency Uhuru Kenyatta. We do now have a mental health action plan, 2021 to 2025, and it highlights various priority pillars where we will be putting in place investments. And perhaps the one that excites us the most is that in the coming few months to years, we shall be moving Mathare Hospital from its location all the way down to Karengong area, in an area that's pristine, that allows for light, for green spaces, and for more recovery and, recovery in dignity. Perhaps we'll borrow your logo there, if you allow us. And really, this is a step towards increasing resourcing of the mental health space in Kenya. As I conclude my remarks, I wish to state that the public and private partnership in mental health will be a key driver to the achievement of the set targets in our plan to ensure that Kenyans achieve the highest attainable standards of mental health care. There are various opportunities and synergies that we need to explore, and we do celebrate the Chiromo Hospital Group for putting this in place and ensuring that recovery occurs in a space of dignity.